Okay, this video is going to look at identifying priority health issues. The syllabus for this asks you to know about the social justice principles, the priority population groups, prevalence of the condition, potential for prevention and early intervention, and also the cost to the individual and the community. The students learn too, to go along with this, is that you need to be able to argue a case for why decisions are made about health priorities by considering the questions that are listed here. So, how do we identify priority issues for Australia's health? What role do the principles of social justice play? And why is it important to prioritise? And I've got to tell you that for HSC exam questions, the number one thing that's come up for this syllabus dot point is why is it important to prioritise? So you need to make sure that you really focus when we get there. So let's start with our social justice principles. Now these are straight from your prelim PDHPE topics. And they include equity, which is the resources being allocated in accordance with people's needs, not equally. So it's about fairness, not about equality. So you have a look at this little image here of the boxes that are used. You can see equality and you can see fairness there, or you can see equity there. And that's about distributing it according to the needs so that everyone gets to achieve what's needed, and then we apply that to health. Diversity is the differences that exist between individuals and people groups. So that might be differences between the ATSI population and the general population of Australia. It might be rural and remote. It might be people who are born overseas. It could be any number of people groups that we look at. But we need to make sure that we're addressing them, particularly cultural groups where we have language barriers and all those types of things. So diversity comes into how we identify our health priorities. We also have to consider the idea of supportive environments. So supportive environments are where people live, work and play that protect people from threats to health and that increase their ability to make health promoting choices. So essentially we're looking at creating an environment that enables them and gives them more power, more control over their own choices and steers them in the direction of making healthy choices for their life. Priority population groups, so groups within Australia with poorer health outcomes than the general Australian population tend to become priority population groups. And so your syllabus is later going to list a whole bunch of these, and they're going to include things like ATSI, rural and remote people, people who have low socioeconomic status, people who are living with a disability. It can be a whole range of different priority population groups, and you'll have to pick a few of those and learn them in a lot more detail later. We also need to think about the prevalence of the condition when we're looking at identifying our priorities. So the prevalence means the number or proportion of cases, instances, or so forth in a population at a given time. So the number of people with a particular disease at a particular time. So in relation to cancer, for example, prevalence refers to the number of people alive who have been diagnosed with cancer. So it might be 30% of Australians have been diagnosed with cancer. Now that may not be true. That was just made up, that statistic. So it is not incidence, and this is, so people often get confused between these two. Prevalence is how widespread it is in the population. Incidence is the number of new cases diagnosed over a specific time period, normally a year. So maybe 100 new people are diagnosed with diabetes every day, or that might then add up to be, 335,000 people diagnosed in a year, which is, again, a made up statistic. So prevalence, the number of people in a population. Potential for prevention and early intervention. This is really key when you're identifying a priority issue, because if you want to actually do something to reduce the incidence of this disease and hopefully address the prevalence of the disease, you need to be able to prevent it. You need to be able to do something about it. So if a disease is preventable, then it is more likely that health promotion will have a positive impact on the health outcomes, and therefore it becomes something that's more likely to become a health priority. So for example, type 2 diabetes, very easy to prevent in terms of fixing people's diets, getting them active in their lifestyle, and those types of things to help then make sure they prevent and don't get diabetes or cardiovascular disease, making sure you're not smoking, making sure you're eating a well-balanced diet with not so many saturated animal fatty products that you're eating. You're trying to reduce those things because we know that that can then reduce your likelihood of getting cardiovascular disease. And so that means that they are more likely to be a health priority. We then look at the burden of the disease, and if the burden of the disease can be reduced through early intervention, then it's also going to increase the likelihood of that disease becoming a health priority. So if I can identify early that someone has cancer and it means that their cancer treatment is more likely to succeed, then that means that cancer is more likely to become a health priority. The same might be used for something like type 2 diabetes, where even if I identify the person and diagnose them early, we can actually prevent it from getting into full-blown type 2 diabetes, or we can do things to address it and reduce the need for management so the burden of that disease is less for that person and for the community around them. We then shift into the cost to the individual and the community. So some individual costs will include things like money, employment, independence, and also their dimensions of health. So think of their social activity, their mental health, their physical health, their spiritual health. It's going to affect all different dimensions of health. We also have to think about the community costs though. So how does it affect their workplace? How does it affect the money that might be involved with their workplace or with their healthcare that's required? How will it affect their family? Will they have to take time off work to care for them? Will they need to maybe quit work to become their main carer and rely on some funding through Centrelink? How will it affect their friends who now will need to make sure they're putting in extra effort to go and find that person, to make some social contacts and to look after them and to care for them? And so we look at diseases, and if they have large costs to the individual and the community, then they're more likely to become a health priority for Australia. So right now I'm going to look at this beautiful triangle that I've come up with. So down the bottom here, you can see all the principles of social justice. So the health priorities should be decided with social justice principles as the foundation or base for decision making. So equity, diversity, supportive environments, and the whole idea of social justice is the foundation of identifying priority health issues. The priority population groups then build on top of that. So the social justice principles mean that we should prioritise population groups with poorer health outcomes to other Australians. We need to make sure that they are getting equity, that we're accounting for the diversity and providing supportive environments for those groups. We have to think about the prevalence. If the disease is more widespread, then it is more likely to be a health issue. If it's rising or falling according to its incidence, it also makes it more of a health issue. So diabetes is prevalent and the incidence is rising, and therefore it needs to be a health priority in Australia. We then look at potential for early intervention and prevention. If it's not possible, then making it a priority issue would be a waste of our time, a waste of our resources. However, if there is potential for early intervention and prevention to occur that will reduce the burden of the disease and the cost of the disease for the community and the individuals, then that means it's more likely to become a health priority. If the disease has a large cost to the individual and the community, then it's more likely to become a health priority because it's having a large effect on people's lives. Now, the one thing at the top here that I put in red on this triangle is really it's the thing that will always govern what actually ends up becoming a health priority. It's not listed on your syllabus, but it is the reality of life, and that is the cost of the treatment. So if we have early interventions, early prevention strategies, the cost that's involved in the promotion, in the screenings, in the drugs that are used for the early intervention treatments and all those types of things, if those costs are really, really high and the government can't budget for it, then they're not going to make it a health priority. They're not going to focus on it and try and fix it. So it's really important that we understand that whatever we're doing as a health priority needs to be cost effective. And that's part of why we actually use this pyramid. Now, what role do the principles of social justice play? Well, they are the primary basis for selecting priority health issues. They are the base, they are the foundation of it. It's used to determine the priorities and how they are addressed by asking questions such as, does the issue meet expectations of the principles? So when we're looking at it, at our health issue, does it actually line up with any of the social justice principles? If so, which ones? And then it means that they're more likely to become a real health priority for Australia. We may also consider if this is a disadvantaged group compared to the rest of the Australians. We might think about, will the application of the principles improve the health outcomes for a particular group? So particularly things like equity, creating supportive environments, and actually doing things around diversity and making sure that we're culturally appropriate, giving things to people in their languages, all those kinds of things. Now, of course, we come to the big one, the one I told you had to focus on. Remember, why is it important to prioritize? Now, if you prioritize your health issues, so you're identifying health priorities, these health issues in Australia, it ensures fair allocation of resources and funding. It helps to make sure we don't waste our money. We need to meet the needs of all our disadvantaged people groups. If we're going to talk about principles of social justice, if we're going to talk about being a country that looks after people, that actually cares about others and not just ourselves, then we need to make sure we think about all people, including those who are disadvantaged. We need to think about supportive environments and how are we going to create them to empower individuals to improve their own health. So if we prioritize, we're really allowing that to happen. We're allowing those supportive environments to be created by using this system to identify health priorities, and that's why it's important. It's also important because health promotion, funding and resources are used to lower prevalent mortality or morbidity issues. We need to make sure we think about how big this issue is and whether or not we're going to put funding towards it.